just washed my hands. Now I'm ready to assess my patient. As she's walking in, I'm going to assess her gait, which is normal. Go ahead and have a seat. And then I'm going to get some background history on her. And what is your chief complaint? Why are you here today?
I need a physical assessment today.
Okay, and I'm going to assess her if she's alert and oriented. Can you tell me your name?
Sarah Martin.
Do you know what day it is?
It is Thursday, April 10th, 2014.
Do you know where you are?
Yes. I'm at a room in long-term care.
Do you know what time it is?
It's 4:30.
Okay. Can you tell me about any past medical history you have?
I had Lyme disease in 2003 and Guillain-Barré syndrome. It started in 2004.
Okay. Did you have any childhood illnesses?
No.
Are you up to date on immunizations?
Yes.
Did you receive your foot shot?
No.
Operations.
Just when I was in the hospital with Guillain-Barré, trach replacement, central line placement, and feeding tube replacement.
Okay. Any other hospitalizations?
Just with the birth of my 3 children.
And were they vaginal or cesarean?
Vaginal.
Any complications?
No.
And they're all alive and healthy?
Yes.
Okay. Psychiatric illnesses?
Not that I'm aware of.
Nutritional status. How tall are you?
5'5".
And your weight?
135.
Okay. And can you tell me what your average breakfast is?
I just eat a bowl of Special K cereal and lots of coffee.
Lots of coffee. Okay. What about lunch?
Usually a salad with some type of protein on it.
Okay. And supper?
Just a protein. We always have a vegetable. May or may not have a potato.
Okay. And do you say you eat more chicken, fish, turkey, or beef?
It's more beef and red meats.
Okay. Do you smoke throughout the day?
Yes.
And what's your
Try to snack on vegetables. Sometimes it's bag chips, but most times it's vegetables.
Okay.
Or fruit.
And caffeinated beverages?
1 to 2 a day.
Okay. Exercise. Do you have any exercise regimens that you follow?
No.
Allergies.
I'm allergic to penicillin.
No other allergies? Okay. Are you taking any current medications?
No.
Alright. Family history. Do you have any siblings?
I have one brother who's in good health.
Okay. And your father?
He is deceased at 63 with heart attack.
Okay. And your mother?
She is 63, living and in good health.
Okay. Maternal grandmother?
Maternal grandmother is 90. She has a history of stroke and TIAs.
Okay. Paternal grandmother?
She is deceased with obesity and diabetes.
Okay. Maternal grandfather?
He's deceased, I think he was in his late 70s with heart failure.
Okay. And paternal grandfather?
He is deceased. He had COPD. I'm not sure what else. I don't remember how old he was.
Okay. Is there any other family history, aunts, uncles that you find relevant?
Just diabetes on my father's side.
Okay. And can you tell me about your social history? Do you smoke?
Smoke 2 to 3 cigarettes a day and drink 3 to 4 beers a week.
Okay. And what's your occupation?
I'm a registered nurse.
Alright. And you live, where do you live?
I live in Johnson, Kansas.
Are you married?
Yes.
Okay. Okay, now I'm ready to start my physical assessment. And I'm going to start by taking a general look at her, and she appears to be in her 30s in overall general good condition. Okay, now I'm going to assess her vital signs, and I'm going to start with her blood pressure. blood pressure is 118/68, which is normal. Next, I'm going to take her temperature. 97.6, which is normal. And then I'm going to check her radial pulse. And I'm going to listen for a full minute, or feel for a full minute. Pulse is 70, and I'm going to continue to hold on to her wrist and observe her respiration so she doesn't change her breathing. Respirations are 14, which is normal. Next, I'm going to inspect her hair. And it appears to be brown in color and straight. It's relatively fine in texture, and I don't see any balding or patches of balding. It's well distributed, it's clean, I don't see any dryness, flaking, redness, or lesions in her scalp or parasites. Next, I'm going to check her face. And when I check her face, I want to make sure that it's symmetrical. Her nose is down the midline, her eyes are even with each other, her ears. I don't see any cyanosis, edema, redness. I don't see any skin conditions. Then I'm going to palpate her sinuses. Tell me if you feel any pressure. Tenderness. No. There's no pressure, tenderness there. And then I'm going to check her facial nerves. Can I do smile and frown? And wrinkle your forehead and puff out your cheeks. And when assessing this, I just want to make sure that everything is symmetrical, which it was. And next I'm going to assess the lymph nodes. And I'm going to start with her occipital. And then move to the mastoid. And then the preocular. Down to the carotid. The submandibular. The submental, the anterior cervical, posterior cervical, and then deep cervical. And then I'm going to palpate her subclavicular. And what I'm palpating for is any pain or tenderness, which she didn't express any. I'm also going to palpate for any palpable nodes, and I'm also going to look for any redness or edema, and I don't see any of those. Next, I'm going to check her vision, and I have a chart on the wall. If you can stand up for me. And if you want to put your glasses on,
Oh, maybe take those.
And can you cover one eye? And can you read this song for me?
Lion's eye, thanks.
And can you cover your other eye? And can you read it backwards?
Just thanks, eye lines.
Okay, good. And then you can come back over here and have a seat. And then I'm going to check her near vision just by giving her my sheet here. And it's got normal 12-point font on it to see if she can read it. Can you just read that for me?
Check radial pulse, then do not let go and count respirations.
Okay, and that is good, thank you. Next, I'm going to have her cover one eye. And I'm going to cover the same eye, and we're looking at each other, and that's help checking her peripheral vision and her tracking. And can you cover your other? And she's still looking at me, so that's good. Okay, next I'm going to check her peripheral vision. Tell me when you can see my finger. Look straight ahead.
No.
And she has an excellent field of peripheral vision. Next, I'm going to assess her eyebrows, which they appear to be clean, well trimmed, and symmetrical and even with each other. There doesn't appear to be any flaking, lesions, redness, dryness. Next, I'm going to have her close her eyes, and I'm going to inspect her eyelids, and I don't see any redness, swelling, or nodules. And then I'm going to lightly palpate them, and her eyelids are still present without nodules, and her eyes are firm. Her eyes closed completely. You can go open your eyes now. And then I'm going to have her look up, and I'm going to pull her eyelid down to check her conjunctivae, which is pink in color, and there's no drainage or redness. And then I'm going to use weapon light and to check her pupil reactivity. You can look straight ahead. And her pupils are equal, rounded, reactive to light. Next, I'm going to dim the lights. To turn the light on. And then now I'm going to check for her red eye reactivity, which is present. And then I'm going to get close to her, and I'm going to look into her pupil and note the color of her iris, which is a bluish green color. There doesn't appear to be any foreign bodies. And then I'm going to find a blood vessel and look up towards the nose, and I don't see any flare-outs, hemorrhages. And then I'm going to check the other eye. And it appears the same. I don't see any flare-outs or hemorrhages. I'm going to turn the lights back on. Oops. And now I'm going to check her tracking. Can you cover one eye and look at my pen? Now uncover it. And she remained looking at my pen, so she's tracking fine. And can you do it with the other eye? Uncover. Good. Can you follow my pen? And she tracked just fine. Next, I'm going to inspect her ears. I'm going to first look at them, and I'm going to note that they're symmetrical. The most prominent part is equal with her eye. They're in the midline of her face. They're the same size. And then I'm going to check for recoil, which is good in both ears. inside them. I've got my light on. And I'm going to look at her tympanic membrane, which is a light gray to pink color. I see a mild amount of earwax, which is normal, and some ear hairs are present. I don't see any redness, drainage, bleeding, perforations. I'm going to check her other ear. And her tympanic membrane is gray in color to pink. I don't see any redness, drainage, or perforations. There doesn't appear to be any earwax in this ear, and just a mild amount of ear hair, which is normal. Next, I'm going to do a hearing test, and I'm going to hit this. I'm going to place it on the top of your head, and you're going to tell me which ear you can hear the better, the left, the right, or both. Okay. And then I'm going to do it again, and I'm going to place it on the mastoid right here, and you're going to tell me when you can't hear it any longer. It's gone. And again. It's gone. Okay. And what I'm checking here is the air conduction versus bone conduction, and the air conduction should be twice as long as the bone conduction. So I'm going to check her nose. I'm going to see its midline of her face. I don't see any obvious drainage, redness, or swelling of it. I'm going to palpate it. Is there any tenderness? No. There's no tenderness to the bone or the cartilage. And then I'm going to look inside her nose. And I don't see any deviation of the septum. There's nose hairs present, which is normal. I don't see any drainage, bleeding, or swelling. Next, I'm going to check the patency. Can you cover one nose and breathe in and out? And then the other side. And both nostrils are painted. Next, I'm going to check her lips. They are a light pink in color. They're slightly darker than the rest of her skin pigment. There's no cyanosis, no dryness, cracking lesions. They appear to be well moisturized. Next, I'm going to check her mouth. Can you bite like this for me? And her bite appears normal. And then open. And her teeth are white. They appear to be in good health. I don't see any broken, missing, or cracked teeth, and no dental caries. Her mucous membranes are all moist and pink. And then I am going to palpate inside her mouth. But first, can you stick your tongue out for me? And move it side to side. And up and down. And she has symmetrical movement of her tongue. And then I'm going to palpate inside her mouth for any nodules, lumps, lesions, or tenderness to her. Okay, and there's no tenderness to her. And right now I would elicit the gag reflex, but I'm not going to for my patient's comfort. Then I'm going to inspect her uvula and tonsils. They're in there. Stick your tongue out. Stick your tongue out. And they're both present and intact. I don't see any whiteness, white patches, redness, inflammation, or swelling. Next, I'm going to check her neck, and I'm going to look first for any JBD, which I don't see any present. And then I'm going to palpate her carotid arteries, both of them, but not at the same time. And they're both palpable with regular rate. And then I'm going to also listen to her carotid arteries. And they also have equal rate and rhythm. Next, I'm going to palpate her thyroid, which it doesn't appear to be inflamed. I'm also going to check the alignment of her trachea, and it appears to go straight down the middle of her neck. And then I'm going to check the range of motion of her neck. Can you look left and then right? Up and then down. And then I'm going to test the strength. Can you push against my hand? And it's all good. Next I'm going to check her upper extremities, and I'm going to note that her arms hang by her side, that they're equal. I'm then going to palpate her arms. I'm going to start with her joints and her shoulder. I'm going to palpate for any tenderness, heat, redness, or heat or swelling. And the elbow. And tenderness. And the wrist. And then the rest of the arm. And she has no heat, redness, tenderness, or pain in any of her joints, so I'm going to do the same with this arm. Okay? No. And her elbow. And then her wrist. And then I'm going to do the rest of the arm. And she has no pain. Next I'm going to check the range of motion. Can you stick your arms out to your side? And then straight up. Front. And to the back. And that's checking the range of motion in her shoulders, which she has full range of motion in. Now I'm going to do her elbows. Can you put them out to the side? And go up, or in, up, down. And she's got full range of motion in her elbows. And then now I'm going to do her wrist. Can you go up, and down, and a circle. And she's got good range of motion in her wrists. Next I'm going to check her nail beds, which at the moment are painted. If it wasn't a demonstration, I would take the fingernail polish off and I would inspect her nail beds for any cracks, yellowness, signs of deficiencies. Her nails appear to all be firmly attached. And then I'm going to check her cap refill on this finger since that's the shortest nail. And it's less than 2 seconds, which is normal. I'm then going to use my pen, and I'm going to check her nail bed ankle, in which there doesn't appear to be any clubbing. I'm also going to note at this time that she has no peripheral cyanosis in her fingers. Next, I'm going to check her radial pulses. And they are both palpable and equal. Next, I'm going to check her chest and lungs. So I'm going to start by a general appearance. And she's got, when she takes the breaths, you can see her chest rising and falling. And then you would measure her anterior posterior diameter against her lateral diameter, and you want the lateral diameter to be shorter or longer than the anterior posterior diameter, which it is. And then I'm going to assess her from the back. And typically you have a gown on your patient, so you would have the open back, or if it was a man, you can have him take his shirt off. But I'm going to palpate for equal chest wall expansion, which she has. Then you would inspect her spine, and you would want to make sure that it goes straight down the middle of her back, which it does. And then I'm going to check for tactile firmness. I'm going to place my hands on her back and have her say 99.
99.
And I was able to feel her say 99, so her tactile firmness is present. And then I'm going to listen to her lung sounds. And take a deep breath. And her lung sounds are good. I don't hear any adventitious breath sounds in any of her lobes. And next I'm going to use percussion on her back to check for resonance. And what you can hear is where the lungs are, and you would hear dullness over anything that was not the lungs. Next, I'm going to palpate her ribs for any tenderness. Any tenderness? I don't feel any broken ribs. And while I'm here, I'm going to palpate her axillary lymph nodes, which none are present. And then I'm going to have her hold her breath when I say so.
Okay.
And then I'm going to palpate for resonance over her lungs as well. Hold your breath. Which she has. And if her lungs weren't filling with air, you would feel dullness along the bottom. You would hear dullness. And then I'm going to listen to the breath sounds in the front. Her breath sounds are clear and she had no adventitious breath sounds. Next, I'm going to check her heart. I would first, if she were shirtless, I would inspect for her apical impulse, which is at the left midclavicular line about the 5th intercostal space, but I'm not going to have her take her shirt off. You can also palpate for it. it is palpable. And then I'm going to have her lay on her left lateral side. And I'm going to start by listening with the diaphragm of my stethoscope, and when using the diaphragm, I'm going to use firm pressure. And I'm going to start by listening at the aortic valve, the pulmonic valve, the pulmonic area, the tricuspid, and the apical. And then I'm going to flip it to the bell of my stethoscope, and I'm going to repeat the same with using lighter pressure. I don't hear any murmurs or abnormalities. Next, can you lay supine for me? And I'm going to inspect her abdomen. And normally you would have them shirtless, or I would have her lift her shirt up, but to maintain the privacy of my volunteer, I'm not going to. And you would note the color of the abdomen. You could also note any hernias at this time. And the color of the abdomen, it's normal if it's slightly lighter than the rest of the abdomen. And then I'm going to check for venous return. And you would find a vein and push upwards. And then let go and watch for the blood return. And then I'm going to check her bowel sounds in all 4 quadrants. Her bowel sounds are present in all 4 quadrants. If I were to not hear anything or to think that they might be hypoactive, we would need to listen for a full 5 minutes in each quadrant before you could declare that. Next, I'm going to listen to her epigastric area. And I do not hear any bruise, which is normal. And next I'm going to percuss all 4 quadrants. And you can hear tympany in all 4 quadrants, which means that there's presence of air underneath, which is good. You would hear dullness over anything that was not. And next I'm going to percuss her liver. You would start at an area of tympany at the right mid-clavicular line. And you would move up to an area of dullness. And then you firmly push up and you can palpate the edge of her liver. And next would be the spleen, and it's going to be on the left clavicular line between the 6th and 10th intercostal space. And you're going to start on an area of long resonance and move down. And when you hear dullness, that's the spleen. And then I'm going to palpate the abdomen with light palpation first. Any tenderness or pain?
No.
And then with deep palpation. Tenderness or pain. And now I'm going to palpate her liver, which is at the 11th and 12th rib. Already showed. And then I'm going to palpate her kidneys. You're going to reach across. You're going to place your hand on their flank and pull up. And it's normal if you don't feel it. And I don't. And you're going to check it on both sides. And I don't feel it there either. And then I'm also going to once again assess for hernias, and you can palpate them, and it would be in this region, but I'm not going to maintain the privacy of my volunteer. And then I would check her lower extremities, and I'm going to note that they are symmetrical in angle and have good muscle tone. I'm then going to check her hips, knees, and ankles for any pain, swelling, heat, or redness. Okay. And then her knees. Okay. And ankles. Okay. Okay. And then I'm going to go through back again and inspect or palpate the rest of the leg. Okay. Next, I'm going to check the range of motion in her hips. Can you bend your leg at your knee and then bring it to your chest? Okay, and then the other leg. Good. And then can you lift your leg straight up? And the other leg. And she has good range of motion in her hips. And then I'm going to have you stand. And we'll check the range of motion in her knees. Can you bend your knee and your hip and lift up? And then can you lift straight? And straight. Good. And then I'm going to check her ankles. Can you roll in and out? And then can you have a seat and go up and down? And she has good range of motion in her ankles. Next I'm going to have her lie back down, and I'm going to do the heel shin test. So if you can take your left heel and place it on your right knee, and can you slide it down to your ankle and back up. And then the other. And this is checking cerebral function, which she has. Next, I'm going to palpate her peripheral pulses, and I'm not going to palpate her femoral at this time, but I will do her popliteal. Which is present and palpable. On both sides, and then I'm going to check her pupil. Which is present on both sides. And at this time, I'm going to check for a home sign, which will check any DVTs. And I'm going to lift her leg and push against and assess for any pain.
No.
I'm going to perform this on both legs. And next, I'll have her sit up. And I'm going to check her coordination. So I'm going to have her do a finger thumb test. Can you go with this in rapid succession as fast as you can? And then with the other hand. Which is good. Next, I'm going to have her do the nose to finger test. You're going to place your index finger on your nose and touch it to my finger. And again. And again. And other hand. Which is good. Next, I'm going to check for deep tendon reflexes. And I'm going to start on her bicep, and you're actually going to hit your own thumb. She's got good there. I'm going to check it on the other side. And then I'm going to move to her tricep. Actually, that was her tricep. And it's good. And next, I'm going to check her brachioradial, which is present on both sides. And then I'm going to check her patellar. There it goes. It's present on both sides. And then I'm going to have her lay down again. And I'm going to check her plantar reflex. And her toes flexed. Next, I'm going to have her sit up again. And I'm going to check her spine. And we already assessed that her spine is straight down the middle of her back. We're going to palpate for muscle tone and any tenderness. Any tenderness?
No.
No. And then we're going to note that she has lordosis in the cervical area, kyphosis in the thoracic, and lordosis in the lumbar. Next, I'm going to have her stand up to check the range of motion in her back. And can you lean side to side, front, back, and then twist. And then I'm going to check her lumbar test. And I'm going to have her stand with her feet together and her eyes closed. And this is just assessing her balance, which is good. Thank you very much. Okay, I'm going to start by explaining how to do the breast exam. You would want to have your patient relax with their arms by their sides, and you're going to inspect both breasts for the size, symmetry, contour, any retractions, dimpling, the skin color, if there's any prominent veins, lesions. And then you're going to assess the nipples and the areolas. You want them to be, you're going to assess the shape of them, the size, if there's any retractions, drainage, nipple inversions. And then you're going to re-inspect the breasts with the arms extended over the heads with the hands pressed on the hips and then pushed together in front of the chest and then seated leaning over. Next you're going to palpate the breasts for symmetry. You're going to palpate in all 4 quadrants and the tail of spins, and then over the areola for any lumps or nodules or abnormalities, pain or tenderness. Next you're going to palpate the nipple, and you're going to compress gently to observe for any discharge, and you're going to note if there's any discharge, and you're going to note the color, the amount, and if it has any odors. Next you're going to palpate for lymph nodes in the apex, medial and lateral aspects, anterior and posterior walls of the axilla and the supraclavicular area. And when you're palpating for the lymph nodes, it's going to be the same. We're going to palpate if they're palpable, if they're movable, if there's any pain or tenderness with them. And then you're going to palpate with the patient sitting and then supine, and then with one arm behind them and then a towel underneath their shoulder blade. Next I'm going to explain the external female genitalia, and the patient's going to be in a lithotomy position, and you're going to start by inspecting the surface for the color, the texture of the skin and the hair, if the pubic hair is well trimmed, if it has any odors, coarse, any parasites. You're going to check for any lesions on the surface. And then you are going to inspect the labia for symmetry, color, any discharge or caking of discharge on it. And it's okay, it may be full or more shriveled, and it's sometimes normal for them to be different sizes, but there shouldn't. And then you're going to palpate for any pain, tenderness, lesions, irritation, or swelling. Next you're going to inspect the urethra for any lesions or discharge, and then also the vaginal opening for any lesions or discharge, polyps or fistulas. And then you're going to milk the Skene glands and palpate the Bartholin glands, and that's to check for any abnormalities in producing lubricant. Next, you're going to inspect and palpate the perineum for smoothness, tenderness, any inflammation, fistulas, nodes, abnormalities. Next, you're going to have your patient bear down, and you're going to make sure that there's no vaginal bulging or any urinary incontinence when the patient bears down. Next, you're going to inspect the perineal area and the anus, and you're going to check for any fissures, lesions, abnormalities with the skin. And then you're going to move on to the internal female genitalia, and you're going to make sure you lubricate your finger and your speculum, and you're going to insert it gently following the path of least resistance. And you're going to inspect the cervix for color, position, size, surface characteristics, discharge, and then the shape of the os. You'll collect any necessary specimens needed for your pap smear, and then you're going to inspect the vaginal walls for color, secretions, pain, tenderness, abnormalities. Next, you're going to palpate the vaginal walls for any smoothness, tenderness, lesions, cysts, nodules, or masses. Palpate the cervix for the shape, size, length, position, and mobility. And in a woman of childbearing years, it should be 2 to 3 centimeters. And palpate the uterus for the location, the position, the size, shape, contour, mobility, or tenderness. And then palpate the ovaries for size, shape, consistency, and tenderness. Next, I'm going to explain the female rectovaginal exam, and you're going to assess the sphincter tone. You're going to make sure you change your gloves and wash your hands in between and lubricate again, and assess the sphincter tone. And then palpate the rectovaginal spectrum for thickness, tone, and nodules. Next, palpate the posterior aspect of the uterus. And then you're going to palpate for any masses, polyps, nodules, pain, tenderness, strictures, irregularities. And then you're going to, when you remove your fingers, you're going to prepare your stool samples as indicated. Next, I'm going to do the male genitalia. You're going to start by inspecting first. You're going to inspect for any visual abnormalities. You're going to inspect the pubic hair to make sure it's clean, free of any parasites, lesions, check the skin color. Next, you're going to, if the male is uncircumcised, you're going to retract the foreskin, and you're going to inspect the glands of the penis for color, and then you're going to inspect the urethral meatus and check for any discharge. Next, you're going to palpate the penis for any tenderness and inspect the scrotum and palpate it also, and note the color, texture, symmetry, if there's any thickening in the scrotum. And then, if indicated, you can use the transillumination to detect if there's any masses in the scrotum. And then you're going to palpate the inguinal canal for a direct or indirect hernia. And then palpate the testes for size, tenderness, bleeding, lumpiness, or nodules. Next is the anus, rectum, and prostate exam, and you're going to inspect the sacral area and the perineal area for the skin characteristics, if there's any lesions, dimpling, tufts of hair, inflammation. And then you're going to inspect the anus for any fissures, hemorrhoids, polyps, fistulas, or if there's any rectal prolapse. Assess the sphincter tone and palpate the muscular ring for smoothness and evenness. You're going to want to make sure you lubricate your fingers. Palpate the lateral, posterior, and anterior rectal walls for any nodules, masses, pain, tenderness, or irregularities. And then you're going to palpate the posterior surface of the prostate gland through the anterior rectal wall, and you're going to note the size, the shape, the texture, and the firmness of the prostate. Oh, and if it's mobile. And then you're going to have the patient bear down, and you're going to palpate deeper for any tenderness or nodules. And then as you remove your fingers, you are going to prepare your stool sample prepare any stool for stool samples. And when you are inspecting the stool, you want to know the color, if there's any blood present, or any other abnormalities in the stool. Thank you.